Good morning, everybody. This is Diana Hinkle, and thanks for joining me this morning. And on this beautiful Northwest day, it's like, oh my gosh, feast or famine, right? That's what you get in the Northwest. Pretty soon we're going to complain that it's too warm. We're not climatized. We go from one extreme to the next. We're 10 degrees under, and then we get 10 degrees over. So it's like, okay, just pick your season and deal with it for the day. So I have a little guest in my hand today. So if anybody hears some little beep, 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 beeps, I have a baby chick in my hand. I was born yesterday, so some of you might have caught that on Facebook. And especially on Instagram, I have a granddaughter that had to video the whole thing. And it's like, okay. So it's a famous chick
Okay.
on Instagram. So this is the only way I keep it to be quiet. So today we're going to talk about oral health. What is oral health? And why would you want to pay attention to your oral health and those around you? Well, first off, I've been in the dental field for over 30 years. So yes, that's my forte. But I have to say this. I was never taught anything about essential oils. You look at an ingredients list, okay, there are things that we use in the dental field that have things like clove or eucalyptus and such like that, right? Well, we don't have any idea really what that background is. It's just an ingredients list. No different than going to the supermarket and looking at what the ingredients are in your products, right? But most of us don't know really what they are. Some of the words we can't even pronounce. So I figure if you can't pronounce it, let's probably don't want it, right? So if we are, when you're thinking about your oral health, why is it very important? Well, first off, our mouth has billions of bacteria in our mouth, okay? The human bite is worse than any other animal bite because we are a mammal. So when you consider that, and if you don't clean up your oral health, then we have other issues going on. We create problems that are systemic, okay? And we can create disease that are systemically, not just in our mouth, okay? It creates a whole body problem, okay? So what is periodontal disease? Do you even know what periodontal disease is? What are the symptoms of periodontal disease? One of the biggest ones that you're going to see is bleeding of the gums, okay, of the gingival tissue. If you have, it's not uncommon to have a little bit of bleeding, okay? That's more of a natural thing. But in flossing is something you should be doing on a regular basis, at least once a day, okay? And if any other time of the day, at night before you go to sleep, that's the most important time, okay? Because you're sleeping and you're not active, so you don't have the saliva going. But when you are thinking about the gingivitis and you're doing the bleeding, if you have an abundance of bleeding, you should be concerned about that, and you should go see your dentist, your local dentist, okay? Even if you don't have dental insurance, you may not have very much money, there are plenty of clinics out there that will evaluate you, okay? It's very important. I see people all the time, but of course, being in the dental field, guess what's the first thing I look at? The teeth. You know, we kind of get taught that, you know, it's like, I don't look at anything else. I don't look at your hair color or your eyeglasses. I look at your teeth. What's your smile like? How many teeth are you missing, right? So I can't get that out of my head. I mean, it's just ingrained in there. It's not going anywhere. So I'm going to read to you something. And just so you know, there are plenty of tools out there. You guys don't have to be 30 years in the dental field to know what you can use or do for your overall oral health. So I'm going to read you something out of the Essential Oil Life book. That's this book here, okay? And I wanted to read this because I want you to understand that you don't have to be an expert in any field, right? We have tools to help us. We have, oh my gosh, we have the internet accessibility, and you can get all kinds of information on there. So I just want to read you the beginning of this, which is talking about oral health. So oral health is often treated separately from the body as a whole. So our whole health is part of our oral health. So health of the oral cavity, the mouth and its tissues, impacts overall health. Poor oral health may be the cause of more serious underlying disease process, or it may predispose an individual to other health conditions. The mouth is colonized by hundreds of different bacterial species that inhabit dental plaque. Plaque is what accumulates on your teeth. And when it's soft at first, but if you never get rid of it by like brushing your teeth or something, or mouthwash, it becomes hard, and then it goes layer by layer by layer, and that impacts your tissues. The species adhere in layers of natural immune responses and must be mechanically removed. Just told you that. Bacteria increase tenfold when the mouth is not sufficiently clean. So if you don't clean that, then you're creating 10 times the problems, right? 10 times the bacteria. A clean mouth contains several hundred billion bacteria, and this number increases with poor oral care exists. Using saliva and gingival fluid to supply their nutrients, bacteria inhabit all areas of the mouth, threatening oral and systemic health. Bacteria beneath the gums, or gingiva, have been reported to be involved in numerous systemic disease. Oral health care, primarily proper cleaning and caution in the consumption of and ongoing exposure to intensely acid and sugary foods like soda pop. That's huge, especially in the United States, and other things, because pretty much there's sugars in everything that we purchase, especially high fructose corn syrup. It's awful. Contributes to a healthy lifestyle. So those things that we eat on a daily basis, if you're not looking at ingredients list and not watching what you're consuming, it's very important to start thinking about that. Essential oils are a particularly effective means of supporting oral health, partly because they are antibacterial and antifungal, okay? So that's naturally. Clove oil helps to relieve oral pain. So if you've got a toothache, use clove oil, right? And that's actually in a lot of the products that the dental field has, is clove oil. But I guarantee you that it's not the real thing. It's a synthetic, okay? So we have the real deal. Cinnamon is another one, and so is peppermint. If you've got, they're very soothing and helpful in eradicating canker sores, okay? Lavender is soothing to sore muscles that result from teeth grinding, or if you've had any dental procedure. Put lavender on the outside along the jawline after a dental procedure, okay? Or you can put it on a cotton swab and put it on the inside of your mouth, because our oils, doTERRA oils, are they're okay to consume, right? So oil pulling, if you've never heard of that before, I really did not have any idea what that was until a few years ago. And I was like, what is oil pulling, okay? It actually is where you take the essential oil with a carrier oil and swish it in your mouth for several minutes, okay? And there are people online that will tell you that it totally reversed cavities and other issues of the oral mouth. But there's not enough specific studies that have been done to promote that. Oil pulling is something that you should do consistently. Okay, so you have to make a decision of what you want to do. But it is a really good thing to do. But I will say that when you do oil pulling, because of all the bacteria in your mouth, don't put it down your sink, put it in your garbage can. Okay, because that is a lot of bacteria. Oil pulling is also particularly beneficial to restoring and maintaining oral health. Specific essential oils can be chosen as part of a routine to target desired results. Okay. So with that, what are essential oils? So we know that, well, some of us may not know, but essential oils are the aromatic compounds that are in plant matter. Okay, they either attract or they are the plant's medicine to prevent disease. So attraction would be like if it's a flower that's going to attract something so that it can pollinate, right? But there are those that need to be, it is, I call it the lifeblood of a plant. Okay, if they didn't have that, they wouldn't thrive. So, and what it can do for us is it's beneficial because we are lipophilic, meaning that we're oil-based, oil and oil mix, water and oil don't, right? So that's why it's very beneficial for us. That's part of it. And we can use them 3 different ways. Aromatically is their biggest and fastest response. Then you can put them on topically, because putting them on topically, you can have a response within 30 seconds. And you can use them internally. Now, not every oil is the same. Always read your labels first, okay? Make sure that you know what you are, that if you're going to put it in you, it's meant to be consumed. So the Terrace, it's easy to know because we have a supplement fact. I'll choose a bigger bottle that shows you. So it has a supplement fact right there. Can you see that? And it will tell you that 1 drop in 4 ounces of liquid. Okay, so when you are looking at a label, make sure, and ours meets the GRAS standard, which is generally regarded as safe for consumption. Okay, all right, so with that said, we talked about why you would consider essential oils, because they're antibacterial, antifungal. Okay, and we're going to talk about several different ones that would be especially good for you. But what are the systemic diseases that can be caused from bad oral health? Okay, so systemic meaning what kind of disease can it create? Because if we're not cleaning up the mouth, we create periodontal disease. Okay, that's the first signs of any problems are when the gums are bleeding profusely. Okay, not a little bit, but you might have a little bit of gingivitis because that's the start. But when it's ongoing and you don't clean it up, then it becomes a periodontal disease. So that's something where it's a little bit more challenging to keep your mouth clean. Okay, it's very challenging. So the systemic diseases are because the tissues are lipophilic, okay, meaning, like I said, we are lipophilic and they are lipophilic, so it absorbs, okay. So diseases that affect a large amount of our organs and our tissues, that's what a systemic is. So periodontal disease in itself and these are all diseases and conditions that are known to be linked to periodontal disease. Okay, this is nothing that I'm not making this up. Okay, you can find it out there everywhere. Osteoporosis. How many people do you know with osteoporosis? Cardiovascular disease. Cancer. There are some cancers. You can pregnancy-induced hypertension. Okay. Preterm births. Metabolic syndrome. Rheumatoid arthritis, stroke, Erectile dysfunction, I know that's something we don't typically talk about, but it is something that is true to think about. Bacterial pneumonia and diabetes. Probably diabetes is probably one of the number ones outside of stroke. There are 3 different factors there. That one, okay, first off, bacteria gets into our bloodstreams, okay? And so of that, there are 3 types of what we call focal infection, which is meaning that it can spread to other parts of the body. One is the massive infection is microorganisms that gain entrance to the blood and circulate throughout the body. It's kind of a normal thing. There's really nothing that it will happen. But when you get into a metastatic injury, okay, some bacteria have the ability to produce toxins that are considered to be the most powerful and lethal poisons known. These bacteria shed their outer membrane. So if you know what a cell is, a cell has an outer membrane, okay? So after cell death, which is called apoptosis, okay? So if you guys want to know more about apoptosis, look it up. It's spelled A-P-O-P-T-O-S-I-S. So apoptosis is something that's normal function of the body. After the cell death, the effect can give rise to a large number of pathological manifestations, okay? Then you have one more, and that's for inflammation of the body. So microorganisms that enter the blood, in instance of bacteremia, can react with antibodies and create complexes that cause a variety of chronic and acute inflammatory reactions where they are deposited, okay? So that's where they actually deposit them into parts of our bodies where we don't like. So we end up with inflammation. What's inflammation cause? Cause pain. What does pain cause? Usually causes us other problems down the road, systemically. So put it simply, when the tissues of the gum separates from the teeth during periodontal disease, it opens up on-ramps, which is like, if you think about getting onto the freeway, okay, it's a fast approaching, got to get up to speed, right, and get on that freeway. It creates for harmful oral bacteria to enter your bloodstream. These bacteria that form plaque on the teeth can form plaques and fatty deposits in blood vessels, or just travel to the organs or parts of the body and settle down to start multiplying, okay? So that's why we want to consider making sure that we're cleaning up our mouth and our oral health because of certain diseases. So since periodontal disease is one of the most common oral infections, that's usually the biggest one that most studies are linked to because of the periodontal. They're not really, there are other studies that obviously are linked to the stroke and other things and the cancers. This periodontal is the number one. And the other thing is too, it also, since osteoporosis is another one of those that is a systemic disease, because we create inflammation in the body, it usually starts with periodontal disease. High blood pressure can be created by periodontal disease. Okay, it's inflammation of the body where you don't want it. It causes fever, okay, high blood pressure. So when we think about that, how many people do you know that have high blood pressure? Ask them if they have any oral health issues. I'll be willing to bet you that they do. Okay, the majority of the people that have that do, or have osteoporosis, have had a stroke. You ask anybody that has had any of these conditions and ask them what their oral health is like. Okay, hopefully they'll be honest with you. Some people won't do that. Okay, all right. So we've looked at what it causes, why you'd want to clean it up. So how do we clean it up? and what are the products that we can use to help us in that area, right? So the Oil Life book, again, I'm going to refer back to that, has a lot of information in there. And there's also the Modern Essential book. And there's others out there as well. Lots of information out there. So one thing to keep in mind, since we're talking about osteoporosis, is what are you doing for your bone health in general? I know women look at that as, okay, we go through menopause and we lose bone, right? But what are the other factors with that? Good supplementation that have high antioxidant properties are very important for us, okay? So I know there's been studies that show that, oh, well, supplementation isn't always cracked up to be. Well, that's true, because most of your supplementation out there don't give you any benefits one way or the other. You really have to do your research, okay? Just because it says 100% or just because it says it has this in it doesn't mean that it's the best that you can get in your product. It doesn't mean that it's all natural. It just, they use that word natural very broadly. So really, really do your research. doTERRA has a really great supplementation line, the Lifelong Vitality supplement packs. And we have a bone nutrient that's awesome. It has the magnesium. I take that daily. It has the magnesium and the extra vitamin D that we need. And by the way, if you don't have enough vitamin D in your body, you can't absorb nutrients from your foods like you should. Okay, so that's very important. And then here in the Pacific Northwest, we see a lot of gray skies. So here we see a lot of depression, and we see a lot of people that don't have enough vitamin D because they don't get enough sunshine. Okay, summertime, not so bad, but wintertime and spring, a different story. So if you live someplace where it's sunshine all the time, I bet that the likelihoods of having the problems are very, very few. Okay. So we're going to talk about the different oils. Myrrh is one oil that we never really talk about. And the myrrh oil in itself, and this is the myrrh, this is how it's spelled. So if any of you know the biblical times, frankincense, myrrh, and gold were given to the Christ child, right? There was a reason why, okay? Very versatile. And if you have a horse, I can tell you what to do with that for your horse, especially if you're breeding. So myrrh helps fight gum disease, okay? And sores of the mouth. So what you can do is, that's one of those that you could do the swishing in your mouth, because you can make your own oil mouth rinse. Most of your mouth rinses out there have alcohol base in them. It's really not a good thing to absorb alcohol in your body, is it? I wouldn't think so. So myrrh is one of those where you can add 1 drop to maybe half to a teaspoon of carrier oil, based on you, right? And swish it regularly in your mouth. Okay, you can also put a little bit of this on your toothbrush and then brush. But when you're brushing your mouth, don't just brush your teeth. Brush your tongue, because it has hair on. Your tongue has hair on it. Okay, you may not see it, but it's got hair on it. Brush your cheeks. Brush the roof of your mouth. Brush everywhere. Okay, not just the teeth. It's important to get everything. Okay. And there are a lot of tongue diseases out there. I'll tell you, it's not fun to see someone that doesn't have a tongue. I've seen that. In my 30 years of experience, I've seen things that you've probably never even considered, okay? So, and I wouldn't want you to see that unless you have someone that really needs that to entice them to not do something, okay? So myrrh oil, really good, really, really good for that. And it's antibacterial. Another one, and this is a little bit harsher, is oregano. So this is the oregano. So now, I will say, use this with caution. It's a very hot oil, and you may not want a whole drop of that in your mouth with the carrier oil, okay? You may need like 1/4 of a drop. How do you do that? Well, it's called a pipette. You can buy things that will give you just 1/4 of a drop, or you just take your finger and just get a little bit off of the orifice reducer on the inside. I'll show you. So right there, there's usually always residue. So just put your finger on it. And if you've got your carrier oil in your spoon or something already, or put it on there. Just you have enough. Okay, it's a very little bit. You don't have to go out and get all this other stuff. Just a little dab on your spoon, put your carrier oil on there, and then use it that way. And you'll have enough. But one drop. There are people that have decided that they can do this just by itself, and they cauterize their mouth. Not a fun thing. All right. Cinnamon is another one. A lot of people love cinnamon. I have a father that's like that. So this is the cinnamon, and this is cinnamon bark. Okay. There's a difference in cinnamons out there. So look up. I challenge you, or I suggest, look up the difference in cinnamons, because there is a difference. So those are all ones that you can use. I mean, there's plenty of other ones out there too. Okay. We can use so many different, and I realized that I'm sitting up with this chick in my lap, and I'm like, hey, I need to sit back. We have a lot. You decide which one you want to use. You can use rosemary. You can use basil. There's so many different ones. Lemon, peppermint. Peppermint's very good for that as well. Melaleuca. Some people don't like the taste of melaleuca, but it's a very high antibacterial. So you want something high antibacterial, melaleuca's the ticket, okay? Or you might do a combination of something. Something you like, something you like. On Guard is another one. On Guard is a blend from doTERRA that, and I don't have the oil itself, I ran out, but this is my On Guard Touch. This is pre-blended, and it's pre-mixed with fractionated coconut oil. Any of the touch oils, that's what they are. A little harder to get out of that bottle, but the On Guard has the clove and it has the cinnamon in there, and it tastes pretty good. In fact, I gotta go check, because today Dad's promotion came out and we got an On Guard dental floss. So if you guys haven't looked in your emails, go check it out. And if you want to get the Dad's promotion, oh my gosh, I'm like, I still want that. I know, I'm like, I'm excited. I was like, I should have been up like at 3 o'clock this morning. No, I should have got up with my husband at 1:30, and then I would have got online. But anyway, so I'm excited for that, because I hope that they did it the right way, because there are good flosses and then there are not so good flosses. So if you're going to floss your teeth, use a good floss that doesn't break, doesn't shred. Like Glide is a really good one out there. It's more of a tape. It's not just a floss. So if you're getting a waxed floss, it's more like a little tiny string with wax on it, and you're going to leave residue behind, and it's going to shred more. So another thing to think about is when you go to the dentist, how many of you have anxiety going to the dentist? A lot of you do. So there are many different options for that. Okay, what's your oil of choice? Lavender is usually probably the number one. And then from there, you can go into a blend called Serenity. And another really great one is Ylang Ylang. Now I've been told that that's not pronounced right, or I'm not pronouncing it right, but I won't try to pronounce it the way someone says. But anyway, it's spelled Y-L-A-N-G twice. And it's a flower. And I probably should look into that and really decide. But Ylang Ylang is something that also is used for anxiety, but it's also used for high blood pressure. So some people like marjoram for high blood pressure. So it just depends on you. Everybody's chemistry is different. So what I like and works for me may not work as well for you. Okay, that's why we got so many different over-the-counter medications. That's why we got so many pharmaceutical medication, because there's a difference. There's enough subtle difference between each brand, that it makes a difference on how it reacts to your body. Okay, essential oils are the same thing. They can all make us react differently. So that's where you want to look at. Another one to think about is Balance. I use this one daily because this is my reduced stress factor. Because it doesn't matter how big or how little your stress is, if it continues on a cycle, then that's very bad for your body. You create extra cortisol, which creates, like, I call it a chemical soup. Okay, you don't want that. You want to get rid of it. Okay, because that can cause disease too. So peppermint or ylang ylang. Another one to consider for anxiety issues is peace. It's part of our new emotional kit that we have. And this is one that can help provide a little bit of calming for you too. So it's just a matter of thinking, where do you want, and first off, what do you have to begin with? Don't think you gotta go out and buy all these extra oils. Here's what you have first, and then decide what you can do or how it helps you. So here's where I'm gonna give you some recipes, and I'll post some of these online. I'll type them out. So for a mouthwash, there are several, and Pinterest has a lot of them. So if you go on Pinterest and go Google doTERRA mouthwash, you'll come up with all different ideas. You can make your own. My father was that way. He just made his own concoction. Worked for him. But you can do 5 drops of Melaleuca, 5 drops of peppermint, 3 drops of clove, 2 drops of cinnamon, and 2 drops of myrrh. Combine them in a 4-ounce glass bottle and fill the remainder with purified water. Okay, since you're going to use water, you got to shake it every time. Okay, because oil and water don't mix. Now you can use something different, but if you're going to use a mouthwash in itself, you could use like a we don't want the alcohol base. The water is better for us, and you're still going to get the benefit. So another one that I have, it's here somewhere. Okay, another mouthwash is just 2 to 3 or 4 drops of peppermint in water, and you can actually do this when you're done brushing your teeth. It's really simple. Just have a little cup there. And I would suggest you have a glass cup, not styrofoam, not plastic that's covered with wax, because you will pull the petrochemicals from that cup, meaning that any plastics or oil-based, or petroleum-based products, you don't want to do that, because it'll melt it, and then you're going to swallow it. You don't want to do that. So metal or glass. So 3/4 cup of water, 3 to 4 drops of peppermint essential oils, or you can just do your cup of water and put 1 or 2 drops in there, whatever you decide you like. You can also do the same thing with cinnamon, okay? Or you can do the oregano, you can do the myrrh, whichever one you prefer to use. Everyone's different. Everyone has a different taste bud. If you want brighter teeth, because a lot of us like to go have that bleaching done to our teeth, which really is not good in my book. Never have agreed with that. Yeah, I know, I'm in the dental field. No, I've never agreed with that. 1 medium strawberry with the stem. And by the way, these recipes are in the Oil Life book, okay, the Essential Life book. 1 drop of peppermint essential oil. You mash your strawberry up into a pulp. You add the peppermint essential oil and mix it well. And you dip your toothbrush into the pulp mixture and brush normally, and then rinse. How simple is that? Okay, a little simpler than having the strips on your mouth, and then and I feel that it destroys the enamel. But, I also don't like the hand sanitizers either, because that's alcohol based, and it depletes your immune system. And I wish they'd get rid of it, because they've already been studies like, oh yeah, that doesn't prove anything one way or the other. And it's like, well then, why do we still have it? Because that's what's been taught. Okay, what have I not covered? So, we know what essential oils are. We know how to use them. We know that they are Essential oils are antibacterial, antifungal, and you can look up in any book or anywhere. You can decide what oil you want. Look at the properties that are in it. What are the compounds? Is it high antibacterial? Is it high antifungal? Is it anti-infectious, anti-inflammatory? What is it? What are you looking for? Okay. Then you decide which one you want to use. Plenty of other things out there. I haven't covered everything. I mean, we'd have to have a little 2-hour seminar, literally, or a day kind of thing for you to understand every little thing. So I want you to have the benefit of understanding a little bit, and then how important your oral health is for your whole body, systemically. Okay. Talk to those people around you that have different issues and ask them about their oral health and see what you get. What's the result that you find? Okay. So I hope you guys got a lot of information out of this. And for those of you that are going to listen to the recording, or you are not a member with doTERRA, we invite you to become a member to get 25% off of retail prices. And that totally is to become a wholesale customer. Okay. There's nothing to do with business, and you don't have to do what I'm doing. All we want you to do is learn how to use essential oils and love them for your family, and so we can teach you what you can reach for that's natural, okay? And a little bit, we can, it's a change of life, and it is a lifestyle change. So get with the person that invited you to watch the video and find out from them how you can get these essential oils in your own home. And by the way, I love doTERRA because of its certified pure therapeutic grade. A lot of therapeutic grade oils out there, essential oils, but doTERRA has a very rigorous standard of quality, and that's what that means, because if it doesn't meet our quality, we don't get it. So that's why we don't have as many essential oils as some of the other companies out there, because it has to meet their standard of quality. So keep that in mind the next time that you're looking at an essential oil. I don't care where it is or who has it. Find out exactly what they're doing and find out exactly where it comes from, because that really makes a difference, okay? All right, guys, have a great week. And next week, we're going to talk a little bit, we're going to start talking about DIYs, which is do-it-yourself projects. Okay, so I'm going to start helping you understand how you can do transfer buys and start learning how to make your own stuff at home. Okay, so until then, we'll see you next week. Have a great one. Oh, and have a great Memorial Weekend. That's coming up, isn't it? I'll be right after. So yes, I will still have a video that day, okay? So I'll see you guys next week. Have fun.